Welcome to Sat to Carry You 2.0 online nursing channel. We are giving everyday 50 questions as a part of preparation for ESI staff nurse exam and Safdarjung nursing officer exam. Continuity of the yesterday's video. Today we are giving another 50 questions for you to learn. Before going to today's video, please subscribe to Sat to Carry You 2.0 online nursing channel. Let's see the first question of the day. Smallpox was officially declared eradicated from the entire world by World Health Organization in the year. Option A 1980, B 1970, C 1960 and D 1990. Smallpox was eradicated from the entire world in the year. The right answer is option A 1980. Question number 2. Multi-drug resistant tuberculosis is one that is at least resistant to option A thioacetazone and ethambutol, B ciprofloxacin and ofloxacin, C isoniazid and rifampicin, D pyrazinamide and streptomycin. Which is the drugs? The right answer option C isoniazid and rifampicin. Question number 3. Pathological imitation of speech of one person by another. Option A. Stereotypy, B. Echolalia, C. Echopraxia and D. Euphoria. The right answer, pathological imitation of speech is known as option B. Echolalia. Question number 4. Massaging the insulin injection site leads to option A. Unpredictable absorption, B. Bruising of the site, C. Tissue damage and D. Infection on injection site. The right answer is option A. Unpredictable absorption. Question number 5. 8 stages of psychosocial development was forwarded by A. Piaget, B. Kraepelin, C. Freud and D. Erikson. The 8 stages of psychosocial development was given by Erikson. Option D is right. Question number 6. Melatonin is a hormone secreted by A. Thyroid gland, B. Pineal gland, C. Pituitary gland, D. Adenoid gland. The correct answer, melatonin is a hormone secreted by option B. Pineal gland. Question number 7. Largest cranial nerve is option A. Trigeminal nerve, B. Olfactory nerve, C. Glossopharyngeal nerve and D. Hypoglossal nerve. Which is the largest cranial nerve? The right answer is option A. Trigeminal nerve is the largest cranial nerve. Question number 8. Dilation of renal pelvis is known as A. Glomerulonephritis, B. Pyelonephritis, C. Hydronephrosis and D is nephrotic syndrome. Dilation of renal pelvis is known as option C. Hydronephrosis. Question number 9. Collection of air in the subcutaneous tissue. Collection of air in the subcutaneous tissue is known as A. Melanoma, B. Empyema, C. Emphysema and D is pyoderma. The collection of air in the subcutaneous tissue, the right answer is option C. Emphysema. Question number 10. Trendelenburg position is provided for a patient with following conditions except A. Following spinal anesthesia, B. Preventing shock, C. During thoracentesis and D. Retaining fluids in retention enema. So in which conditions we are not giving Trendelenburg position? So here the right answer is option A. Following spinal anesthesia. Trendelenburg position is not given followed by spinal anesthesia. Option A is right. Question number 11. World Breastfeeding Week is celebrated on A. September 1 to 7, B. September 15 to 21, C. August 1 to 7, and D is August 15 to 21. The World Breastfeeding Week is celebrated in August 1 to 7. Option C is right. Question number 12. Causative agent of whooping cough is A. Coxiella brunetti, B. Borrelia recrunetis, option C. Xenophycelia brasiliensis, and D is Bordetella pertussis. So the whooping cough causative organism here is option D. Bordetella pertussis. Question number 13. End stage of renal disease occur when the glomerular filtration rate is option A less than 25 ml per minute, B less than 15 ml per minute, C is less than 35 ml per minute, and D is less than 45 ml per minute. So in which condition the end stage renal disease is occurring? The right answer is option B. When the GFR is less than 15 ml per minute, it leads to end stage renal disease. Question number 14. A non-nucleated cell in the human body is A. Erythrocyte, B. Leukocyte, C. Chondrocyte, and D. Osteocyte. The non-nucleated cell in the human body is option A. Erythrocyte. Question number 15. The most important essential fatty acid is option A. Eciospantotonic acid. Option B. Linolenic acid. Option C. Arachidonic acid. D. Linoleic acid. The most important essential fatty acid is option D. Linoleic acid is right. 16. Health Survey and Planning Committee is popularly known as A. Bohr Committee, B. Mudaliar Committee, C. Mukherjee Committee, and D. Kartar Singh Committee. The right answer is Mudaliar Committee, which is known as Health Survey and Planning Committee. Question number 17. Dose of vitamin K given to a neonate after birth is option A. zero point 0.2 milligram, B 1.5 milligram, C 1 milligram, and D is zero point 0.5 milligram, which is the dose of vitamin K given to neonate after birth. It is option D, zero point 0.5 milligram. Question number 18. Dread of high places is called A. Agoraphobia, B. Zoophobia, C. Claustrophobia, and D. Acrophobia. Dread. The fear of high places is called. The right answer is acrophobia. Question number 19. The HCG level in normal pregnancy reach a peak level at option A 60 to 70 days, 60 to 70 days, B 20 to 30 days, C 40 to 50 days, and D 0 to 10 days. The peak level of HCG hormone at the time of pregnancy is between 60 to 70 days. Question number 20. The concept public health was born in option A. Greek, B. Rome, C. China, D. Egypt. In which country the public health concept was born first? The right answer is option B. Rome. Question number 21. A hyperpigmented patch on the cheeks and face of the pregnant woman is known as option A. Colasma, B. Palmer's sign, C. Snow, and D. Higger's sign. The hyperpigmented patches on the cheeks and face of the pregnant woman is known as. The right answer is option A. Colasma. Question number 22. An example of proton pump inhibitor. Option A. Cotrimoxazole, B. Pantoprazole, C. Fluconazole, D. Mebendazole. Which is the proton pump inhibitor? The right answer is pantoprazole. Question number 23. Father of Indian surgery is A. Charaka, B. Sushruta, C. Atreya, D. Vagabta. The father of Indian surgery is option B. Sushruta. Question number 24. First antipsychotic drug used in schizophrenia. Option A. Lithium, B. Amitriptyline, C. Chlorpromazine, D. Imipramine. The first antipsychotic drug used in the world is chlorpromazine, CPZ. Question number 25. The occupational disease caused by the inhalation of cotton fiber dust over a long period of time is option A. Bagosis, B. Anthracosis, C. Silicosis, D. Bicinosis. The occupational disease caused by inhalation of cotton fiber dust over a long period of time is option D. Bicinosis. Question number 26. The following is not an extrapyramidal symptom. A. Parkinsonism, B. Anhedonia, C. Dystonia, and D. Akathisia. Which is not a extrapyramidal symptom? The right answer is anhedonia is not an extrapyramidal symptom. Question number 27. After snake bite, which of the following one is not a correct management? Option A. Calm and reassure the victim. Option B. Immobilize the affected part. Option C. Wash the wound with normal saline. Option Option D is make a incision on the bite site to drain the blood. Which of the following intervention is not a correct management for snake bite? The right answer is option D. Make an incision on the bite site to drain the blood. It is not a correct management for snake bite. Question number 28. The first mammary secretion is option A. Prolactin, B. Colostrum, C. Lactogen, and D is relaxin. The first mammary secretion is option B. Colostrum. Question number 29. Lateral deviation of the vertebral column is known as option A. Kyphosis, B. Herniation, C. Scoliosis, and D is lordosis. The lateral deviation of the vertebral column is known as scoliosis. Question number 30. A weak bulgy spot in a blood vessel is known as option A. Aneurysm, B. anastomosis, C. Collateral artery, D. None of the above. So, weak bulgy spot in a blood vessel is known as option A. Aneurysm. Question number 31. Rheumatic fever is diagnosed by option A. Vidal test, B. ASO titer, C. EA factor, and D. None of the above. So the rheumatic fever is diagnosed by ASO titer, option B. Next question. Scientific name of cobra is option A. Vipria russellii, B. Rana hexadactyla, C. Banagarus cerulus. Option D. Naja naja. The scientific name of cobra is option D. Naja naja. Question number 33. The child dosage of drug is determined by dash formula in Western medicine. Option A, Young's formula, B, Hicks, C, Hess, and D, none of the above. So in Western medicine, to calculate the dosage of drugs of children, we use Young's formula. Question number 34. Jaundice is seen in option A, leptospirosis, B, typhoid, C, brain tumor, and D, lymphadenitis. So the jaundice is present in option A, leptospirosis. Question number 35. Finger nose test is done to elicit the damage of. Finger nose test is done to elicit the damage of option A, cerebrum, B, cerebellum, C, spinal nerves, and D, medulla oblongata. The correct answer is to elicit the damage of cerebellum, we perform finger nose test. Question number 36. Digestion of both starch and protein is done by option A, bile, B, gastric juice, C, gastric lipase, and D is pancreatic juice. So for the digestion of starch and protein, we need option D, pancreatic juice. Question number 37. Burners gland are present in option A, abdomen, B, stomach, C, esophagus, and D, ileum. Where is the Burners gland are situated? The right answer is option A, duodenum. Next question. Rocky Mountain fever is caused by option A, ticks, option B is fungi, C, algae, D, mosquito. Rocky Mountain fever is caused by the right answer, ticks. Question number 39. Iodization of salt is done to prevent option A, goiter, B, scurvy, C, beriberi, D, pellagra. Iodization of salt is done to prevent. The right answer is option A, goiter. Question number 40. Emergency management of angina is option A, adrenaline, B, aspirin, C, nitroglycerin, and D, dopamine. In case of angina pectoris, the emergency drug is nitroglycerin, option C. Question number 41. India launched National Family Welfare Program in the year option A, 1947, B, 1951, C, 1987, and D, 1960. The National Family Welfare Program was launched in the year option B, 1951. Question number 42. Which stage of labor is known as phase of placental separation? First stage, B, second stage, C, third stage, and D, fourth stage. The placental separation occurs at third stage of labor. Question number 43. Conal atresia affects option A, neck, B, anus, C, nasopharynx, and D is heart. Conal atresia affects the nasopharynx. Question number 44. Normal head circumference of newborn baby is option A, 33 to 35 centimeter, option B, 25 to 28 centimeter, option C is 36 to 41 centimeter, and D is 45 to 52 centimeter. The normal head circumference of newborn is the 33 to 35 centimeter. Question number 45. Mini lap is used for option A, D, and C procedure. Option B, it is a family planning method. C is to collect pap smear, and D is none of the above. situation. So mini lab is used in the family planning procedure. Question number 46. Concept of therapeutic community was introduced by option A. Maxwell Jones, B. Freud, C. Erickson, and D. Lazarus. The concept of therapeutic community was given by option A. Maxwell Jones. Question number 47. Treatment of alcohol dependence is all except option A. Disulfiram, B. Naltrexone, C. Flumazenil, and D is acamprosate. So here, except flumazenil, all the three drugs are used in the management of alcohol dependence. Question number 48. Clavicular fracture is treated by option A. Fixation with plate and screw, B. Open reduction internal fixation, C. Skeletal traction, and D. Figure of 8 bandage. So the right way to treat the clavicular fracture is option D, by putting figure of 8 bandage in client. Question number 49. An older adult patient who is experiencing extreme stress related to an admission in the hospital would be expected to demonstrate option A. Increase heart rate, B. Decrease blood pressure, C. Irregular respiration, and D is dilatation of pupil. So an older adult patient who is experiencing extreme stress and related to an admitted in the hospital. So because of the extreme stress, they will have increased heart rate. And the 50th question of the day: a patient who has pacemaker might be ineligible for option A. Computer tomography, B. Electromyography, C. Magnetic resonance imaging, and D is electroencephalography. So here, patient who has pregnant pacemaker might be ineligible for magnetic resonance imaging. So this is the end of today's video. Please click these two videos to watch more questions. Thank you. Bye bye.